Welcome back, everybody. Sorry for the delay. It is still February 18th. And we are starting, we spent yesterday all afternoon going over all of our budget asks and requests and governors recommend. And today we are going through and we are ranking each individual person's priority. I'll open it up for discussion first in case anyone has any questions or wants to discuss anything. I have two items on here that I would like to discuss before we vote. Voting, here's how it works. And I gave Nolan a key this year. So everybody gets their top 5 priorities ranked 1 to 5, whatever your most like, this is my favorite top number 1 priority, that every single individual's person, they will get 5 points for a 1, 4 points for a 2, 3 points for a 3, 2 points for a 4, and 1 point for their number 5. And then we take everybody's priorities, we add up all those amounts, and we rank the committee on 1 through 5, what our top asks are, or we rank all the things that got votes in the order of the number of points that each got. And then we submit this entire spreadsheet to appropriations, and they will have the tally of how staunchly we favor something or are, I would say, agnostic on it. So, first of all, I wanted to open it up if anyone has any questions about any items. I will say that there's a lot of people who are around the room. So, if maybe you're missing an answer to something, but yeah, I could find somebody around the room that could answer it.
Are we allowed to explain our vote?
Yes, you may explain your vote. Absolutely.
I have a point about a correction.
Let's get the correction and then Val has questions.
On the first line, B306, Viva Personal Services, VLA/HCA. That's not for the healthcare advocate. That's just Vermont Legal Aid. It's pure legal work. And it is a Medicare advocacy project contract that they're canceling. I just wanted to be clear that it's not for the Office of the Healthcare Advocate, that they have a separate ask down. Anything else, Mike?
And it lives in the Dale.
Lives in the Dale budget.
Speaking of Mike, I'm sorry, Mr. Healthcare Advocate, did you get any clarification on the umpteen different funding sources that apparently you get funded from, billbacks and all sorts of things?
We think we did. We
Okay.
have enough to get us through today.
Okay,
So, in short, they're asking for a $450,000 increase. That's about $203,000 in general fund.
okay,
If it's wrong, I'll correct it in the appropriations. That's where we're still waiting for one flat fee. But I think that when you break it down between the board and AHS, I think that's, yeah, sure.
and DFR. Oh, you said 203, I'm sorry.
Yeah, I don't think there is any in DFR.
There's no. Okay.
They said they didn't have it.
Okay.
But I'm getting clarification. So that's where we're at the moment. So that's what you can operate on until further.
Good to know.
203.
And that could change. About 45%.
Let
I missed all that, but that's okay. I'm sorry.
essentially that asking for 450,000, but because of the mechanism and the way the Office of the Healthcare Advocates funded, it's not all general fund. Some of it comes from bill back
Okay,
from AHS and Fremont Care Board.
thank you.
So, Val,
I think I clarified. It was regarding the DNA.
and Sash and why they're not combined. Or why they would not be, but it's a totally different entity.
Tori, would you be able to answer?
I was looking at, I had both VNA highlighted and Sash,
Yes, they're two different things.
yes.
Yes. So SASH is the support of home for low-income seniors that it is done normally. There's like buildings where the residential buildings where people are, where they're supported. And then there's also, they have components where people in the community can be supported by SASH too.
Specifically, senior.
Low-income seniors, yes. Yeah.
May I ask, Brian, I know you're on Zoom. Do you have all your priorities spreadsheet? I don't know if you had an updated spreadsheet since we
I
were
am
on.
I'm driving and I should be there in a few minutes.
Okay,
So I was hoping to do it in person, but if you need me to speak or weigh in before I get there, I'm here on Zoom. So
no, that's all right. If you'll be here in a few minutes, be
I
fine.
think 15 to 20 minutes is my estimate if I don't speed, which I'm not.
Okay.
So right.
We'll go slowly. We'll explain our votes a lot. So I want to talk about is it any other questions that anyone has, anything, or do you think, I feel they're really clear? Yeah, go ahead, Leslie.
Well, I don't know the answer, or I haven't heard it, but, you know, with the demise of One Care and the gap before plus or minus ahead, because we don't know. That just means that primary care practices are going to have a cut in income. That's what I understand, right?
They're not gonna get the Medicare portion of Blueprint payments.
And do we know how much that is? Is that what this is,
You
or,
know, we got
and where does it, is it on here, or, because this is a big number, and
it's a new number.
I'm trying to like make sense of this number.
Have to find. Unless Lori gets there first.
No, I didn't see it.
Oh, okay.
What's that?
It is on the bottom of the second section, and it's mixed in with. So it is not 7.7 million.
Where's it on the sheet?
Second from the bottom, page one.
Yes. Oh, that's different. I'm sorry.
That's different. Do we have the missing Medicare per member per month? The blueprint?
I have Blueprint numbers. I don't have the one here. I mixed them up.
Did we not have the blueprint on the sheet?
The blueprint, we have blueprint numbers, but
Is
no,
that
it's
one?
not on here
Yeah.
So, yeah, so we're,
because we just found out that it's not funded.
Oh,
Mr. Green, Blueprint's funded through Medicaid,
yeah,
but not the gap, not the bridge.
yes, okay. Well, it's not on here right now, so I think we're gonna leave it off and maybe
It's not
information.
on there, we can't vote
If,
on
if,
it.
if it's not on here and we haven't heard about it, but remember, this is just the beginning of the process. The budget goes on for a long time. Okay. Anything else? Discussion of just right, other than the two things that I think we should talk about? Okay, so we have in the governor's recommended budget, they are recommending that we increase prescription copays for people on V Farm. From currently, there's a $1 copay and then a $3 copay. And they're requesting that we increase that copay from instead of $1 to $4 and $3 to $8. So I think that the testimony that we heard was that due to HR1, it requires that there is cost share, but we've always had cost share. And that there wasn't anything in HR1 that said they had to increase cost share. So, I wasn't here yesterday when you all went through this, but was there discussion on, does it have to be 4 and 8?
We didn't really discuss.
Oh, we didn't discuss it.
We went through all of them but we didn't actually discuss in detail, any of them.
But I think somebody said it didn't have to
It
be.
didn't have to.
Right, so I think how.
It can be
It
anything.
can be anything. And it can be what
It could
it,
be anything.
it could be still what it
It
is.
could be 1 and 3
Right.
or, can I make a personal statement here?
As long as you're not influencing people out.
I'm not. I'm not. I had let's call them a constituent. And somebody who's very, very close to me who actually works in the department at DEVA that administers all of this. And she called me almost in tears and she said, Mom, pharmacies call all the I think I just got my daughter in trouble.
Finish, sorry.
Pharmacies call all the time and she says, Mom, they can't afford $3 now. They're never going to be able to afford $8. And I just, first of all, I was a little overwhelmed because, like, oh, this is why I love daughter. But I mean, this is raising and $8 to somebody who makes very little money, especially if you're on multiple prescriptions, chronic conditions. This is a lot of money to them. I mean, $8 may not seem like a lot,
Yeah.
but that's a lot when you live.
And can I add to that, that you have to buy into a Part D program, so there's already cost in that. Then you're paying a premium for Bee Farm on it, on top of this. So I think it's a little overkill, if you ask me. Oh, I'm not supposed to, I'm
Well, we
sorry.
just,
And I don't think it's not just B farm, it's all Medicaid. It isn't just for B.
Yes, I heard that,
It's
yeah.
all medication. So you can be at the lowest poverty level
Yes.
on Medicaid, and this would apply to you too. And the other thing that I think it's really important to remember, and maybe this is just a philosophical thing because we're facing the loss of so many federal funds. Remember, anytime that the state of Vermont collects either premium or copay, that has to be shared with the federal government. So it's like a reverse FM.
Yeah.
For every dollar we collect, we have to send 60 cents of that to the federal government.
That's just premium, I don't think it's copay.
I think it's on copays, isn't it?
We'll look.
Okay. I think I asked that question. So, I mean, the fact that we're cutting and putting on the backs of Vermonters, for Vermonters, and then sharing it with the federal government is a little, I don't know, disheartening. Easy.
Are you saying that if we do nothing on this line item, the state will be bringing in money from people on Medicaid Part D's co-payments? They will be making money off of those co-payments.
It's not Medicaid Part D.
I think so.
They will essentially be paying less for that prescription, which means they will be saving money on the prescription.
Okay.
And then part of that savings gets shared, state and federal. I'm gonna make a recommendation that we might want to, and I don't know the numbers and how it would affect this line item budget, but that maybe we suggest like a 2 to 4.
This going on. What?
We'll make the recommendation on this particular line that that we don't agree with 4, 8, but that maybe we would be amenable to 2 or 4.
This has nothing to do with 5 choices, right?
Nope.
Will those numbers differ if nobody has them in our top 5? You're talking about changing the numbers 2 to 4, or is that gonna make a difference if it's not in our priorities? And,
This would be outside of
This
our
would be
priority.
outside of our priorities.
oh, okay, so we can,
Priority, you know, get an extra one.
oh, okay,
Is how I'm looking at it.
okay, I see. Okay,
Go ahead, Leslie.
I'd just like to make a counter thought. I think we should leave it as it is. I think poor people are really getting slammed. The price of fuel, the price of food, the price of everything. This is one place where we can say, we hear you, let's leave it as it is.
Meaning the 1 and the 3.
The 1 and the 3.
Not just low income people, it's everybody.
No, it's Medicaid.
It's everybody who has Medicaid or,
Is it just Medicaid?
yeah, this is like cost share on.
Okay, so.
No,
working
B farm
person-
too, you
For B
said.
farm.
Yeah.
person may be on,
Oh,
what I'm thinking of is somebody that goes to work every day.
It's,
let's pull out,
Yes.
let's pull out the chart.
I just, wait, I can,
Yeah, go ahead. No, or you can- no, it's fine. Okay. So first of all, it would be for any, anyone on Medicaid, which is currently 138% of FPL. It would be on Medicaid working disabled below 250% of FPL. It would be on age, blind, disabled, at or below poverty,
Projected income limit.
expected income limit. It would be on pregnant women below 213. It would be on children below 317. It would be on Medicare Part D, so this is older Vermonters over the age of 65 or on disability who buy into V Farm and they pay premium based upon their income level below 225%. I pretty much covered most everyone, right?
Yeah.
That's some other categories, but yeah, this is who, yeah, go ahead.
I'm getting from my people is that there's no penalties for Dr. Minnesota.
Okay.
They're still suspended.
Oh, yes, I'm sorry.
Yeah.
No premiums for, okay, so no children. Um. So that's who we're talking about.
You say what 138% of FPL is up? Yeah, I can't read that, believe me.
for an individual, 22,000 a year, a family of 4, it's 45,500 a year.
I think I just think that in the spirit of supporting the governor's recommend and the challenges that Diva is facing. I mean, I would love to keep it 1.3.
How much could it add up to?
Well, they tell you.
Yeah, it's not like that.
$1.43 million total between state and federal.
State is 461,000.
Oh, wait, I'm sorry, I'm looking at the wrong line. Sorry.
Out of an $8 billion.
Really? 461,000. Base, general fund.
And then the part that goes to the feds.
Partially goes to the feds, it's basically, what they're doing is they're assuming a reduction of spending. They're not taking the COVID, so this is, I think, we were.
Oh, I see. So-
With Representative Black. They said they're assuming a reduction in their spending. And so because that reduction in spending, they're federal, so it's not like part of the premium is going back, it's that they're reducing their spending. That's where the mix up with Rep Black.
Yes.
No, okay.
Are you gonna ask for a straw poll on that?
Yeah, I think I'll ask for a straw poll. If you want to say something?
Well, I don't know.
I'm gonna ask for a straw poll on my proposal that we recommend to appropriations that it go from 1 to 3 to 2 to 4, but not 4 to 8.
I'm gonna second that.
Okay, I don't think we need a second person.
Oh, that's right, Commission.
I'm gonna ask for a straw poll. If you agree with me, raise your hand. If you don't, because you want to keep it at 4 to 8, don't recommend that. Wait, I
Yeah.
haven't asked a question
Yeah,
yet.
it's just said if you agree with.
So there are 3 different options though.
Like, if you don't agree with that, don't put your hand up. For whatever reason, either you want it to be $100 or $8 or $3, don't put your hand up.
1 and 4, right?
1 and
Yeah.
2 and 4. Okay, 1, 2, 3, 4, 5, 6, 7, 7. Okay,
Ryan, get,
Now, you had another on the floor. So
no,
that
that's
means
where she.
that you can't bring up the other one.
what do you mean?
It was voted down. I voted down
She voted down.
because the way she phrased it was you accept this. A vote yes means 2 to 4. A vote no means you don't want 2 to 4.
Means you don't want to change it from the 1 3 it currently is, or you want the
I
governor's.
don't want to change.
Okay.
From your 4 to 8,
No.
oh, from the 1 to 3.
Yeah,
I want to
Great.
change.
7 to 4. All right, moving on. So the 211 that's on here, it's at the very bottom. It's under DCF. It's in DCF, which means we didn't particularly hear about it that much. That's more of a human services thing. I'm requesting that we recommend this if they're able to use this surplus that's in the HIT fund as a one-time.
So just so you know, this is on here twice. So it's in as a reduction of hours, but then on the back page, it's in as the Epic and 211 integrations. So I think we're saying we're okay with the reduction of hours,
Yes.
but we want the money for them to do the.
For the integration.
Yes.
Yeah.
There would be 2 separate decisions.
Yeah, exactly. You're right, because I'm sorry, the governor's recommend had just the reduction in hours. But then they came in and they said, hey, we're doing this integration thing. So those two work together. And we could use hopefully we could use the HIT money in the surplus for this integration. So if everybody's in agreement with that recommendation,
This would mean that the hours wouldn't be cut, right?
well, I think they're cutting anyways the base. But we're sort of making up for it with this one-time money for this program that they're trying to get the IT infrastructure to work. That makes sense? Okay, all right, I'm gonna recommend that. Hey. Anyone want to volunteer to go first? Tupper.
Might as well.
Okay.
Are we just doing one?
Okay, remember, Tupper, you only get 5. He always tries to slip extras in.
I got 6 here.
Okay,
And I'm only gonna do 5. I just made a decision.
remember they have to go in the order that
You
you.
like to have.
Yeah,
Right, 1,
But
2,
you,
3,
you
4.
want.
1 is 5.
Speak slowly.
Yes.
Right.
1 is 5. Are you ready?
Yeah.
B3. 1.
Can you say what it says?
Under
Area Health
description.
Education Center, AHEC.
Education, what?
AHAC,
That's number 1.
the number 1 priority.
Is someone keeping track?
I
Yeah.
am, and Nolan is. too.
Both Nolan and,
Number 2, Visiting Nurses Association. That's under reimbursement rate
Yep.
requests.
That's for the 3.5%.
Yep. To 3, Support Service, SASH. Four, Vermont Free and Referral Clinics. Five and 6.
just 5.
5, Vermont Care Partners.
3%, 3.5%.
That's a question.
Yes.
I was just wondering about, a lot of that has to do with Dale. So just wondering if Human Services had a position on it.
They have heard the same testimony we've heard and they'll make their recommendations.
They haven't done it yet.
May I ask, Amy, is the ask to the Human Services Committee the same as the ask to us?
Yeah, Johnson Vermont Care Partners is 3.5%.
Yes. Okay. Anything you want to say anything about?
That's what, do you want us to talk about?
If you feel like you want to go on
Well, I
record.
can do
why
some
you
of the night, oh, yeah.
I want people to feel like they're heard.
sure. Do I still have the microphone? Okay. I think that the AHAC thing, that addresses provider shortage. We've had it for a long while. We still have a shortage of doctors and nurses. And I think that if we're gonna solve this healthcare problem and the cost of it, we have to have staff to do it. And people can't afford to go to school. So I just think that's what I have for years. 2, Visiting Nurses Association. That allows people to stay at home, get treatment. It'll keep people out of the hospital because they'll have people coming in all the time to help them.
Wait, which one was that you just explained?
VNAs,
Okay,
VNAs.
VNA. That keeps the cost down. This is all my opinion, by the way.
I'm sure there's data to prove.
Yeah, there's data to back there. SASH, it's probably one of the best programs that I've come across in my 22 years here to help elderly people. The services are provided right on site, or they can be, and they can be provided outside as well. So I think SASH is a great program. The Vermont Free and Free Clinic, I've been in support of that. since before it was created, as a matter of fact. Helped create it. This does a wonderful job, and it's especially important now where the price is so high. People can't afford healthcare. So I think this is an integral part of the healthcare system. And a lot of people are served by this that would not be served. Let's see, what's my last volunteer partners. I mean, this is a statewide thing. They need staff. If we need to have more incentives to staff a lot of these places where the services are provided and the people that are in the place to provide the services. So I just think that that program along with BHEC is extremely important in providing and helping with the workforce. So that's it. How's that?
Thanks.
What we do in 6 now? I can do it
No,
quick.
you. It's not gonna get any points, but
Well,
what?
if the 6 ones come in, we have any ties, I can help. Okay,
All right,
who's number 2?
who wants to be number 2? Val.
Because I'm nervous and I don't feel like being
I want to get
nervous.
it over with.
Because we're system, I'm going to be.
Yes, I want to move it.
Yes.
Thank you.
Okay, thank you, Val.
B314, Team 2. I'll explain after.
Number 1 is Team 2.
Yes. I have B311, A. Anybody? Reverse side, Vermont Free and Referral Clinics. Next, I have SASH. And visiting nurses. And I'll just go back, I think they're all pretty self-explanatory, but I'm going to go back to Team 2. I think if this service had been maybe established only a couple years ago, I may not have had my heart tugged. 12 years, the connections. I really respect when people devote so much time and energy into something and they see it grow and prosper. And I was sold that it's making a difference. There.
Good. Good job.
I just, I could use those into AHEC, free and referral clinics, SASH, and then VNAs. Okay, if I'm gonna try to order.
Let's go next. Go ahead, Wendy. Wendy. All right. the
Wendy,
two of us
Wendy,
are
go ahead,
crossing.
Wendy.
Go ahead, Karen.
Sorry, really, if you. Thank you. Of course, this is the first time I'm having to think about these things, so it's very daunting. But my order is 1 visiting nurse association. 2 Vermont Free and Referral Clinics. 3, and I did a blur, but maybe I'm not allowed to. It's B311. It's two items, but one being AHEC and the other, the education loan repayment system. But I'm thinking of those as one, and if they're not, I prioritize AHEC.
So AHEC is 3.
Yes.
Yeah.
4 is SASH.
Rated loan repayment is not on your priority.
If it can't be
Yeah, yeah,
a combined 3, then no, it's not.
okay.
So 4 is SASH. And 5 is Vermont Care Partners. And I'm thinking of, access to primary care, to the value given to folks that are receiving it, the quality. All of these programs really need to deliver. And what we raise.
Yeah, you want to go next?
Sure.
Okay.
One, Visiting Nurses Association. 2 is SASH. Is Vermont Care Partners. 4 is the American Heart Association. And 5 is the Vermont Medical Society, American Association of Pediatrics.
There's 2 for VMS. Wait, the top one, so you want a rate increase? Or you want restoration of some of their one care funding, like a gap?
The DIVA professional fee schedule.
Okay, so increase 2.67 inflationary adjustment for rates. Great.
Where is that?
Any
Where is that?
about that?
Oh, the Heart Association's on that
Yeah, I got it. That was,
second, there's.
that was BNA, SASH,
Wait, no, I was talking to Deb.
Yep.
Oh,
BNA, SASH, Vermont Care Partners,
Mhm.
American Heart Association.
Yep.
VMS rates.
Yep.
All set? Great. Who'd like to go next?
Pleasure. Well, this is my 6th year and it's still daunting, even dauntinger, if there is such a thing. Because it's all good. I mean, it's important stuff that we've been asked to think about and address. And I tried to spend time thinking about sort of an overarching theory of how to approach it. And that was harder. That was really hard too. But I sort of landed on, you teach someone to fish kind of thing. So that's sort of where I landed. So my first one is VSAC and my second is AHEC. And that's because in all my years here, we've been suffering from workforce shortages and we just need to address it. And I'm worried. I know we heard that it might come through the transformation grant, but I don't know when. And there's people in the pipeline and I don't want to give up on them. And I feel like that would be really not good. So that's my 1 and 2. My 3 is actually the HCA because of the amount of money that's saved through that office for Vermonters and the support that population gets from for all of us. I mean, I don't know how many people I refer as a HCA. It's crucial to the functioning of many families. I feel like people who work for the state get a standard increase in their salaries. I don't know what it is off the top of my head, but I feel like that also should apply here. So I'm supporting that.
okay. What is it?
HCA, healthcare advocate.
Oh, okay.
My 4th one is the VNA, because I agree with Topper that we need people to be home. when they come out of hospitals and they need recovery support. And my fifth one was going to be the Medicaid reimbursement money. So now I have to come up with something fast because I really didn't.
Can I give you my 6?
Yeah. I just think that I'm going to, I don't know that it needs to be $7 million. So I'm just willing for some kind of number to support primary care practices in making that, in filling that gap. But it may or may not be that number, and probably not that number because that's huge. But I would like to support primary care once again. We need primary care. It's the infrastructure of our healthcare system.
Which would you like to support, the professional fee schedule or
No,
the 7.7?
yeah, the 7.7, some number.
So that's number 5.
Yeah, some number there. It doesn't have to be that, but at least if practices get,
The bridge funding.
yeah, some kind of support until that could be settled.
Read back to you.
Yeah.
Number 1, FEPSAC, and then AHEC, and then HCA, increase, BNA, and then public primary care ACO.
Yes. Thank you.
Alan, you want to go next?
Sure. Okay. Number 1, I put visiting nurses. That's dear to my heart up home. I've seen it operate. I've seen it do real good things. Number 2, Vermont Care Partners. Number 3, the Vermont Medical Society American Association of the 7 million. And I said, if I'm going to go with that one, then I got to kind of go with keeping it going. So I went with 4 is with the fee schedule, and 5 was SASH.
Right back to you.
Sure.
BNAs.
Yep.
Care partners,
Yes.
support for ACO, support for primary care, so it's ACO.
Yep.
EMS rates.
Yep.
And then SAC.
Yep. Thank you.
Thanks, Alan.
I think you're welcome.
Lori, do you want to go next?
Sure. I have community outreach in Chittenden County with a request for a language that they create a transition plan so that we can revisit this next year. If it gets all the way through. Is 1, 2 is SASH. 3 is Bridges to Health. 4, sorry.
What is what?
No, she hasn't said it yet. No one told her to slow down.
3 is what?
Bridges.
Which health is 3. Okay, sorry.
You good? 4 is Vermont Free Referral Clinics. And 5 is VSAC.
The VSAC, not the AHEC.
Yeah.
Can I read back to you? Community outreach, the county. SASH, bridges, referral clinics, recycle.
Yeah. And can I just make this statement?
Yes.
I feel like, 1, I was against the return to office initiative. And although it's not a ton of money that's now being put into leases, it is still money being put into leases that did not need to happen. And a couple of these things that were cut could have been funded if people were allowed to work where they were being productive. So I want to be very clear about that. And then the second thing, which is not on here, there are some big increases to the Agency of Digital Services that have been unable to be explained. It was in the news that there's a lot of unknown about how ADS is charging and why it was such an increase. And I think just in what we look at, it was a couple $1 million. That's a big problem. I have not something we can take up in this committee. And bottom line is this budget request from the administration seem to be more focused on infrastructure and things instead of people. And we see that clearly with everything that's being cut here. And that is a big problem in my eyes. Thank you for letting me clear that.
Let's see. No, Wendy already went.
That Wendy went.
Oh,
That Wendy went.
Her name was mentioned.
Wendy.
There, Wendy. Okay. Yeah. My number one is the VLA Alpha School Healthcare Advocate. I don't know if I have to explain this, but I've been working for Diva for a long time, and this is my go-to place, and I still have PTSD from when the Affordable Care Act rolled out, and so what they do is incredible, and I appreciate everything. So that's number one. Number two, and I hate that all you people are in here because I know I'm gonna I'm sorry. I have to go with the community outreach, number two, and that is our town manager actually called me last night. And I didn't understand how valuable this really is, and I do now.
It's in the governor's recommends down here, the community outreach team.
That's kind of thrilled. Number three, House-Speed Bridges. Number four is SAF. And number five, I'm having such a hard time with number five. I don't know. It's between visiting nurses and the education loan repayment. They're both our infrastructure for healthcare. Who's coughing over there?
Not allowed to say.
There's no three health secretary that let her make the right decision.
Yeah, I'm thinking about the future too. Like, my own personal health care, I'm gonna go with visiting nurses.
Rebecca,
Yes.
HCA,
Mhm.
community outreach, bridges, dash, DNS.
Yes.
So
Yep.
I can go. Am I the last one?
Yep.
So,
No, you two are good.
Cool.
Two more.
You and Daisy. All right, and then I'm last.
I assume you want to go last.
Yes.
Yeah, exactly. So I'm ready then. I'm gonna vote, even though I'm gonna vote to be a good sport and cooperate with the process, but I do so under objection, and I'll explain why at the end. So, number one, the Vermont Free and Referral Clinics. Number two, Vermont Care Partners. Number three, Team Three, Team Two.
Okay.
Number four, Area Health Education Center
Yep.
Program Support. Number five, SASH.
So Vermont Free Clinics, Care Partners, Team Two, AHEC, SASH.
Yes. So the reason that I object to this is not because I think that the process itself is flawed, but the premise on which the process is being based, which is that there's not enough money or that we have to make cuts. Nolan might be able to tell me. I wasn't here to ask, so I don't expect you to tell me this, but I tried to add up all the cuts and all the asks quickly. And it's 20-something million in cuts. I don't know if you can confirm what that number is, and 20-something million in requests. That's 40-something million that we are either gonna cut or not fund. In the big beautiful bill, the top 1% of Vermonters got a $201 million tax cut. So if we just recuperate that money that's not asking anyone to pay any more than they ever paid, paying the same, we could fund this and still have 160 million to fund other things. So it's like, I just feel like we are being played here. In fact, if you look at the top 20% of Vermonters' tax breaks, $736.2 million. At people over $500,000 a year, just those folks, the tax breaks are $280 million, just to put it in perspective. So even if we decided we're going to give everyone under $500,000 a year the tax break, but ask those over to pay the same they paid before, we would have $280 million. So in that context, it's very painful to be sitting here like King Solomon cutting the baby into pieces. And I say this with no judgment of us. I have to speak this because it's like I feel like I'm doing this under duress. And that we've heard from the state economists before, I don't know if everyone has, that when you're in a tight spot, there's three things you can do. You can deficit spend, you can cut programs, or you can tax more. And when we deficit spend, it's sometimes it's smart to go in the hole to keep a program open, because cutting it, you lose all the investment you put into it. And that's why cutting programs is one of the least appealing things to me, because when we cut a program, for example, Teen 2 I'll use, because just an example, however many years of investment in building a program cannot be quantified in that simple yearly budget cut. We're losing all the money we spent and more in capital in like human resources. And so for every single cut on this page, that applies. And so I respect that we're trying to be cooperative with the governor, but I very much fundamentally disagree with the premise that there's not enough money. We are being turned against each other so that the people at the top exploit us worse than they ever have. And so, on that note, thank you for listening.
I appreciate
Yes.
your comment very, very much. Thank you. Daisy.
My number one is the Vermont Care Partners. Because I noticed all the state workers who do those same jobs are getting a raise this year, and the designated agency staff aren't. So I think the 3.5% rate increase is a respectable request. Community outreach is my number two, because that's an incredibly important service to Winooski, and my mayor wrote us a letter you all read this morning. Bridges to Health is my number three. And Healthcare Advocate is my number four. And the free and referral clinics is my number five. And I think those are all very important services. We've all heard why. And I think those rankings reflect the needs of Winooski.
Vermont Care Partners, community outreach, bridges, HCA, free referral clinics.
Yes.
All right. All set? Yes. Okay. My number one is bridges. My number two is free and referral clinics. My number three is VNAs. My number four is the community outreach team. My number five is the Office of a Healthcare Advocate is my number five. I thought I had a sixth one, but I counted wrong. I counted it.
Can I read that again?
Yes.
So bridges,
Yep.
free clinics.
Yep.
VNAs.
Yeah.
Community outreach. Whitefish.
Yeah. So do I get to explain my vote? First of all, I really appreciate Lori making that, and I want to make a point. I had calculated out with the amount that had been put into the budget adjustment, $432,000 a year. That's how much we're just paying in rent. And if you recall, we asked a lot of questions about toilet paper and this office supplies.
Yes.
432,000 could have funded multiple things on here. And 7 staff, I mean, they're asking for 12 staff positions. Could have funded 4 or 5 of those staff positions. Not to mention, I think that they're gonna have trouble filling those 12 positions because they're already losing people because of the return to the office policy. So I want to make that point also, that I hate that. Community outreach is incredibly important to my community. I have heard from many, many people. I know how vital it is. And I always say you cannot replace it with crisis, because when you respond with a crisis, it will become a crisis. You all know how I feel about bridges. And same with the free and referral clinics. They serve a need that nobody else serves to a population that has no options for accessing, basic healthcare. And I just think that the work that they do is amazing. I'm going to give of course, the VNAs. I don't, and if this rises, I've heard it many times, I promise I will do a better job of advocating with House Appropriations that this is not the same as other items, which is what happened last year in the budget. And then I would just say, guys, I had a discussion, somebody mentioned to me the other day that the Office of the Healthcare Advocate is a lobbyist. And I don't dispute that at all. But I'll tell you what, one of the only people that is in this building that's a lobbyist, who is his client and who is that office's client, and that office's client is Vermonters. And I don't know a lot of other lobbyists whose entire job is to look out for Vermonters. And I think about all the things, Leslie, you mentioned this, in the last few years. If it hadn't have been for the Office of the Healthcare Advocate, we wouldn't have the expansion of MSP, which has saved Vermonters tens of millions of dollars. We wouldn't have IHIP. We did a bill on Medigap last year that was brought to us. We have Charlie in here all the time, who is saving and working hard to ensure that Vermonters save on their prescription drugs. We have, Emma, all the things that they do in policy, and that doesn't include the people that we don't see who are on the phones every single day working for Vermonters. So that's why Mike's on my list. So, there's my explain my vote.
Oh, shit.
I'm done. Okay, Pepper.
I just want to say something to the committee as a whole. Now, I could be wrong on this, and we'll find out what happens. But we all, based on what I reported for votes, we all thought pretty much the same way on the top 5.
Pretty close.
And to me, that's great. This was not an easy job. And we all came out voting for
A lot of the similar things.
similar things.
Yeah.
We're a great committee.
Nobody,
No, I think
nobody,
it's fascinating.
I did want to say, nobody gets 6 votes, and I don't even get a 6th vote.
No.
But if I hadn't messed up in my head the number, it would have been AHEC. Lori's point of, we're not investing in people. We have been working so hard on workforce. And when we say we value the workforce, to have those be some of the first cuts, it kind of boggles my mind a little bit. Go ahead.
I just wanted to say, I think the healthcare advocate is foundational to so much of the good work that happens. I mean, for me, it goes without saying that that work should be supported. It's just done so much good. But it was in this process, just like I don't know, I wanted to say you start with that and then, I don't know, I just think it's very important as well.
In the past, our budget letter has often included language expressing opinions about spending or bigger picture trends, et cetera. How would people feel about a few sentences capturing my point that was phrased in a way that was less inflammatory, maybe, or less passionate? Like, for example, we were asked to accept X million of cuts and there were Y million of requests. And in the context of this, we asked our committee to follow this process and then you explain or something, or we were asked to pick 5 each or something. However, we would like to point out that if we recaptured all the Trump tax cuts, we could fund all these programs and avoid all these cuts.
Typically, our budget letter, I think, starts with, this is how much we had in requests. Don't we usually?
Generally with credit council, I don't think I can really put that in unless that's something you want.
Oh,
I looked at last year's and you expressed appreciation. I mean, you always express appreciation for the opportunity. You express some general principles and values.
Yeah.
And then we talked about.
So we could put in our general principle.
So my argument, you don't put the number of
Yeah.
value requests because we don't know, I have verified numbers.
Okay.
I also don't want to politicize it. I wouldn't be comfortable.
But we usually do have a little blurb in there about our values.
If people aren't comfortable, it's okay. To me, it is, but everything we do is political, so.
Okay.
I take it back. You did last year, put in how much you were asked for.
Yeah, I thought that there was a number, because the number kept changing at the last second. Maybe we won't, we won't do that this year for NOLA.
A lot of moving pieces.
Leslie?
I'm not sure how to phrase it, but I agree with Brian in that we are being forced into this very stupid box. And I agree, with Lori that of all the the cuts are about things and not people, and it's all pretty heartbreaking, which is what I started with. But I'd like our letter to comment on that if it's appropriate, to think about what we were asked to do by the administration. Not that, going to appropriations, so they're the ones that are gonna hear about it, they know on some level, but I do think we have to think about opportunities to get to look at more revenue somewhere. It's not only about cuts, it's about how to, like you said,
Yeah, it's directly related to the big beautiful bill too, which is what these cuts are related to. It's all the same underlying policy decision that was made federally.
Yeah, so it's a consistent theme of let's not support poor people, which of course why I did my Medicaid vote. And I feel really bad about that.
I have Topper and then Lori.
Go ahead, Lauren, you go before me.
Yeah.
We've been through this before. I went through it last time.
You've been through this a lot. I do not think we should politicize this. I think we, in the past, have always said, that we've made some comments about hard work, right? We support all of these things that are helping people. And I think that's what we have to keep it to. We do not, in this committee, have the ability to raise revenue. And so therefore, I don't think we should comment on it.
Okay. Thank you, Laurie. You all done?
I'm all done.
I agree with you all. That was-
Love that.
That's what I was gonna say. No, that's what I was gonna say. I don't think we should mix it in here. Although I might agree with it.
Right.
Well, I think another thing is to consider that the budget that came to us, we have to assume that there were difficult decisions made there as well. And I don't want to imply that there weren't. Like, I do not think the commissioner of mental health that sat here and told us about all the programs being cut. I don't think that was easy for them. And I don't want to even approach the idea that it was.
I don't want to imply that that's what I'm saying. I think it came from above that. So the commissioners had a hard road. I get that. And this is what they were able to come up with in order to meet what they were asked to do. But it's heartbreaking.
It is. And I think our process was amazing and I really respect that, like Alyssa said, most of our things kind of came to the top. We were all pretty aligned.
So,
Who said that?
wait a minute.
I did. That's a pretty good point.
We have not gotten the results yet.
You want?
We haven't gotten the results yet.
Oh, I know
Nolan, would you like to announce?
it. We're gonna check your figures.
We were lockstep,
Okay,
so we're number good. So number one is the DNAs,
okay.
two is the Vermont.
Yeah, now you're going too fast.
No, sorry.
I'll email it to you.
Two is Vermont free referral clinics. Three is SASH. There was a tie for number four.
Ooh, that's always dicey when we go to.
So it's-
That bumps out 5.
AHEC and Vermont Care Partners tied at 4. And then 5 is community outreach.
So then we're allowing 6 to go through.
No,
Because in an election, there's a tie, then the 5th one gets bumped out and the 2 4s.
Well,
Well, that's that kind of voting.
okay, this is the human services.
Just those, I mean,
What's the other four?
Ties.
AHEC and what?
AHEC.
So basically what we'll do is we'll just sort of list like how many points each of these got and how they were all ranked, because, I mean, they should know that some other things had votes on them. So, but those are our top 5. 6.
are you going to 5 or 6 now?
Well,
Five.
we had a tie on one of
Okay.
them,
In
so.
ties, you go,
Exactly, you bump
So
out
we
the
flip a
bottom.
coin. Should we flip a coin?
I think it's your call. You could also just recommend.
We'll just recommend both.
How about we just recommend 10? And then add
The tie on.
It was AHEC. and Vermont Care
I don't think we should change the process now.
We didn't pick 10 to.
Put them
Do
both.
another round of
I
voting.
don't even know what the sixth one is.
No, I said each of you gets 5. I didn't say we were gonna make only 5 recommendations.
Oh.
Recommendations. Okay,
Say
hey,
that again?
so we'll straw poll this, but I don't wanna straw poll it right now because we might have some language and I wanna make sure that everybody's good and I wanna make sure everybody's good with the letter that we send. So we'll draft up the letter and get this all drafted and tomorrow we'll squeeze in, I mean, it won't take us more than a couple minutes. And then we'll just straw poll it.
Now, I asked what the 6th one is.
The 6th one, what was
Healthcare
the 6th?
Whoops, sorry.
6th one was
Community outreach.
Community outreach.
Number 5.
Well, you had VNA, referral clinic, SASH, Vermont Cares, and AHEC. What was the next one?
What's the last?
Vermont
one?
Care.
What is Vermont Cares?
What was the last one?
And then community outreach.
Free clinic, SAC, then AHEC and Vermont Care Partners tied at 4. Then 5 is community outreach.
Okay. Yeah. Okay. We will. We're gonna put it in. We can make as many recommendations as we want to. All right, so everybody all set? I think
So now we're gonna have a letter.
we'll have a letter and then we will.
I'm not, no.
So tomorrow's Thursday, we
I would
really,
suggest
we
like,
only have, afternoon committees, don't forget.
No, you're right.
Oh,
What is going on?
We have
We're on the floor in the morning.
We have all that stuff on the floor.
Right.
we have a lot of important votes tomorrow.
We're still on live, everybody, so just keep that in mind. Yes, of course you may.
Listen, tomorrow, we've just talked about how important it is to be here at 9 o'clock on the floor. I'm bringing that message from the speakers.
Yeah.
It's incredibly important.
Yeah.
It's very important that everybody is in their seat at 9 a.m.
Okay.
Okay,
I'm always there.
all right. Everybody, we can go off of live. Thank you.